Hello and welcome to this episode of Hampton Roads Business Live. My name is Rory Graham and I'm your host, and today we have the pleasure of having with us Gary Rodfuss from Fairfield Psychological Associates. Welcome.
Glad to be here. We
haven't had anybody from this field on here so far, so you're the first, and it's a very interesting field. What is your title?
I'm a licensed clinical social worker.
Okay, there you go. All right, so give us an overview of Fairfield Psychological Associates.
Well, Fairfield Psychological is an outpatient psychological practice. We see individuals of varying ages. We see children, we see adolescents, we see adults, and we see people for a variety of problem areas, usually kids with school problems, individuals that have depression problems, anxiety, just a wide range of issues that people are seeking counseling for.
Okay, so I think you just answered my second question, which is, okay, so on those lists, so the ones that I'm familiar with, you hear about all the time is like depression,
yes,
anxiety, those, I think those two are probably the biggest ones that I hear about all the time. Is that pretty common?
Yes, you're correct about that. We see people that have what we call biological disorders, meaning that perhaps something chemically is off balance, and that will produce what we call a major depression, a major depressive episode. Could be anxiety, it could be panic attacks, ADHD, obsessive compulsive disorder. And in addition to that, we see people that have what we call situational problems. And those are the kind of things that all of us have to deal with at one point or another. Those are life events that cause conflict, that cause worrying. It may be going through a separation or divorce. It may be dealing with a child or an adolescent who's having problems. It may be something that's work-related, job stress. So a range of situational problems that we help people with.
Okay. Is counseling a difficult thing to go through for people?
It's really not. It's become very accessible, meaning that a majority of people that have health insurance is as easy as calling up my office and you speak to a friendly secretary who can inform people often what their benefits are, or at least verify what their benefits are. And then it's just a matter of picking out a counselor or a therapist or a doctor and making an appointment. And then just, it's as easy as that.
All right, so the type of people that would seek you out, are these, I mean, do you work with military families or non-military families? I mean, we're such a military
Well, I'm glad you asked that, because we are a community that has so much military surrounding us. And yes, we work a lot with all major insurance companies. That includes the commercial insurances. And a large population that we see is the military. Military dependents, we see a lot of families. Military families, like the rest of society, they have the same difficulties that all of us have to deal with. But oftentimes it's magnified because of the stress related to serving in the military and families dealing with deployments and separations.
Yeah,
so
I bet that's
enjoy
a big
working.
deal, yeah.
It is. It's a very big deal. Not just for spouses, for kids, for adolescents. The whole family is impacted a great deal by everything that goes on in the military.
Yeah, I think with some of the movies that have come out and some of the stories and some of the foundations that have come out, you're getting to know more about that side of things, that it affects the whole family, and that it's it can be quite traumatic for them coming back.
Well, I think that we become, in general, more open about discussing problems. I think people are becoming more open and willing to admit that they have difficulties that they need to seek help for. We don't see that that embarrassment that people often used to have about seeking mental health counseling. But for the military, they make the insurance very accessible and easy to use. And of course, we've got significant numbers of people that are serving overseas and are coming back, and they may not be getting all the services through the veterans hospitals, for instance, and a lot of them are seeking outpatient care.
Okay, all right, and all this is confidential.
Yes, excellent question. As people worry a great deal about that, but we have strict rules. We have guidelines that are based on our professional organizations that we're members of. We have guidelines through the licensing of the medical boards of Virginia, and we have guidelines based on the HIPAA privacy laws to the federal government. So we don't release any information to anyone unless there's written consent, and it's got to be for a specific reason.
All right. And do other family members participate in therapy?
Yeah, oftentimes we see a lot of couples. Many times when we see children, we include the family. And so I think people don't realize that that can be very flexible depending on your counselor and depending on what your treatment goals are, that most counselors are flexible and will do different combinations of seeing individuals, couples, as well as families.
And that's kind of up to you.
It's kind of up to us, but I'm looking at it more.
I mean, it's kind of up to the patient.
Oh, yes, that's what I was going to say. It's more of a partnership.
Yeah,
right.
Because I mean, if you're stressed because you can't juggle your marriage and your girlfriend's schedule, then you wouldn't want your wife in on the session.
Well, if that's the case, you've got some significant problems.
I'm just teasing.
Yes.
Okay. All right. So I have a question here. If someone is depressed, why not just get medication? You see all these commercials all the time. Why not just ask the doctor for some medication?
I'm so glad you asked that, because people do see those commercials and that drives people to go to the doctors and say, can't you just put me on? Well, the research on that shows that most people with depression, anxiety, with conflicts, they do better with a combination of medication and talk therapy. So a lot of times when people go in for what we call medication management, they only see that person once every 6, 8, 12 weeks, whereas your therapist you see on a regular basis. So if it's done well and it's done proper, your counselor or therapist will coordinate and work with the person prescribing your medication, and they work together as a team. So it's much more effective when it can be managed through medication, but you have someone that you're talking to on a regular basis at the same time.
Is the goal to get them well or just to manage the symptoms?
The goal is to get them well. So in a sense, the goal is to rid ourselves of business, meaning that a lot of people
But
start
that's not
off...
the goal of the pharmaceutical company. Usually for them, I guess, it's to manage the symptoms of the problem. They're not correcting the problem, right?
Yes, you're getting into a whole other area here, but I do agree with you to a certain degree.
Right.
The pharmaceutical company has
But I mean,
vast amounts of money
that's where
invested
going
in
together
advertising,
works.
and and I agree with you. So that's where it's not just responding to an advertisement from a pharmaceutical company, but you're getting care that's specific to your needs, and you have treatment goals that are specific to what your needs are.
So hopefully you can get yourself off of.
Yes, because now there are some people who stabilize and they do well, and they go through a trial period of getting off their medications. And then we see a number of individuals who need to go on what we might call a maintenance dose of medication for a long period of life, for a long period of time.
I wasn't saying it wasn't helpful, but I was just trying to say that that is a major difference, is that your goal would be not just to address the current symptoms, but to work to a plan to where they're better.
No, I agree with you, because
so.
my philosophy and the other counselors at the office, we try to look at the entire well-being of the patient, and so we're looking to do the medication if that's needed. We're interested in counseling. We're interested in promoting our patients to make healthy choices, to use their time wisely, to minimize stress, to exercise, to eat properly. There are other things that people do that enhance healthy chemicals in the brain, and so they're not dependent just on medication.
Right. Okay. All right. Well, I agree with that. The question I have here is, what other ways do counselors help other than talk therapy?
Well, the approach that we often take is that we advocate for patients, that we want to see people do well. So sometimes that includes dealing with life stresses. So if somebody's having a work problem, and medication is not going to solve that. So often we at least advise or present information. We write letters to support people. We help them with things like seeking family medical leave if that's appropriate. We help people to seek disability when that's appropriate. When we work with children and adolescents, we often work together with the parent and the school system. We do a lot of extras. We write those letters that suggest that a student may be eligible for an individualized education plan. We'll consult with and provide information to guidance counselors. We try to do whatever we can that's going to be helpful towards the patient's entire well-being. Okay. And that includes all little extras.
So you got an end goal, whatever, that would help further that. Okay. How time-consuming is this? Because you you hear of people that are going to therapy forever,
Right.
So I guess sometimes people think that that's always the case. How time consuming?
Well, for people of my generation, the old Woody Allen joke
Yeah.
of going to psychoanalysis 5 days a week just doesn't exist. Most people...
It does for Woody.
It does for Woody. It probably still does. But most of us, average people, they see a therapist approximately once a week. Sometimes if there's a crisis, they may be twice a week. But it's usually once a week for about 45 to 50 minutes. And then as people do better, as they reach their goals and they improve and stabilize, you start spreading the appointments out. And maybe every 2 weeks and maybe once a month. So there are times when people seem like they're in therapy for a short time, or it may be they're in therapy for a long time, but that may be once a month. Or we have people many times who come in, they do well, they stabilize, and they come back 6 months later because there's a crisis. And they may see the counselor 2 or 3 times and they're fine, they solve the problem, and we may never see them again, or they may come back a year later. So it's not as time consuming as people may think it is.
Right, okay, all right, well, Hollywood just gives us a false impression
Yes.
of a lot of things, right? Okay. Is there anything I didn't cover that you'd like to mention? Did I forget something?
I think you did a good job of asking those questions. The only other thing that I might add is that I consider us community-based, meaning that we're right there located in the heart of the Kempsville area.
Right.
So we're near a lot of schools, we're near a lot of businesses.
Right
we're
off
right
Providence, yeah.
we're right off Providence Road, close to residential neighborhoods.
Okay.
So I think that's important for people to know. We have easy access to get to us, and we consider ourselves part of the community.
All right, well, great. It's good to have you as part of the community.
Thank you. Pleasure being here.
All right. If you have a need that you think therapy might be able to help, or you're not even sure and you want to talk to somebody to see if that's the case, or if you know someone who could utilize this service, you can give Gary a call at Fairfield Psychological Associates. The contact information is at the bottom of this page and at the end of this video. And I'm sure that they would be willing to talk with you and accept most insurances and things. So check them out. I thank you very much for coming in today.
You're welcome. My pleasure.
Wish you much continued success.
Thank you.
All right.